Navigating COVID-19 for Moms and Babies. My name is Abby Buckhouse, and I am the Manager of Policy and Advocacy for Generate Health. We are so excited to have all of you yet again for another week for an awesome conversation we're super excited about. So as customary, before we get started, I will share a couple of housekeeping notes. Because of the number of attendees that we have, we've muted all of your lines. However, we do very much encourage your questions and information sharing. So if you could use the Q&A function at the bottom of your screen to send us your questions, and then the chat box to share information and resources that you have to share with the group. And then we'll capture all that information, share it in the chat box, and we'll send it out after the call. So Q&A function is for your questions. Send those as you have them, and we'll kind of insert them in the conversation. And then the chat box for information that you have to share with the group. We are recording this webinar so that it can be shared later with others, and so y'all can go back and visit it as well. So without further ado, we'll go ahead and get started. Generate Health is a maternal and child health coalition. So we were founded 20 years ago, and our mission is to mobilize the region to advance racial equity in pregnancy outcomes, family well-being, and community health. We see our role in this crisis to convene the maternal and child health community to share information about how people who are pregnant and postpartum are at risk for COVID-19, to coordinate resources that respond to the needs of service providers and community members, and to identify collective action opportunities. So today we are going to have a fantastic discussion that will focus on some policy solutions to both equitably address COVID-19 and to rebuild our systems for a more equitable future. So to provide their input and expertise, we have Cora Faith Walker with us. She is the Director of Policy with St. Louis County and a former state rep. And then we also have Tashara Jones. She is the St. Louis City Treasurer, also a former state rep. So we have some ladies with some awesome backgrounds. And then we will have Sharonda Thompson joining us here in hopefully a few minutes. She is a mother of two. She's also been a fantastic advocate using her voice for Medicaid expansion, women's health services, and state and federal policies related to those. She's also a member of our Community Leaders Cabinet and also a co-chair of our Flourish More initiative. So thank you so much for being here today for this important discussion. We are so excited to be able to have a conversation about the future and moving forward, and aimed at finding some policy actions that we can work together to make a shift towards equity. So I'll be interjecting some audience questions as we come along and as they're relevant to our conversation. If Tashara and Cora, if you want to take a second to just say hi to everybody to kick it off, that'd be great. Cora?
Good morning, everyone.
Awesome. Did we just have, oh, we're working on Sharonda. So as she gets on, she's working on through some technical difficulties, as is customary with Zoom and webinar. So we'll give her a little grace and let her hop on here in a minute, but I don't want to delay our conversation too much. I know there's a lot that we can dive into and talk about. So let's jump in, and then we'll catch her up when she gets on the call. So during this crisis over the past couple of months, we've really seen systems change in ways that they really told us were impossible for. And so I really want to start by hearing from both of you, what major system changes have you seen during this time, positive or negative, that really impact Black moms and babies? And who's truly benefiting from these changes? So, Tashara, get off.
Wow. I don't know if I could classify what I've seen during this pandemic as systems changes. I think that it has exposed our inequities even more, as we see from the people who are laid off or furloughed or lost their jobs, and people who have then been classified as essential workers and given hazard pay, I put that in quotes, for working during a pandemic. For example, grocery store workers who received raises who are now considered essential employees, some restaurant workers. And the one thing that I've noticed is that, as they have received increased pay, it's like, by golly, we could have been paying these people a working wage all along, and companies could have survived. I think the other thing that it has exposed is how much our society is dependent on entertainment and sports and travel and hospitality, as we've seen those industries sort of, almost fail. The treasurer's office is the parking supervisor, and we've seen a huge drop in revenue because there's no entertainment anymore. Most of our business, or a good chunk of our business, relies on sports and concerts. And we haven't seen any of that, and we don't know when it's going to return. So it's been a sort of real eye-opener to what our society values, and what we're dependent on during these last several weeks. Cora?
Yeah, so Tashara and I've talked often throughout all of this, that this is going to really kind of just be like a normal morning call we have. So I'm really glad to see that she's a panelist, and I really appreciate this opportunity to participate. One of the things that I will say that I've noticed that has been a change that took some time to actually get there was the coordination between the major hospital systems around the area and the kind of the creation of the pandemic, the regional pandemic task force that Dr. Garza is leading, but that also includes BJC, Mercy, and St. Luke's. The sort of commitment to trying to collaborate as opposed to compete for those systems is something that is different and certainly warranted in this crisis. But it's also something that I think it would have been nice to have while we've been talking about challenges that mamas and babies are having with access, and as we've been talking about it for a while. I think one of the other things that I've noticed, and just really kind of to Tashara's point and to give the perspective from St. Louis County, is really the sort of reliance that many county governments around, or that many governments, especially in the county, the city, really in the entire state of Missouri, the dependence on sales tax revenue to help provide general revenue, and then that in turn being used to provide government services. St. Louis County, about a third or so of all of St. Louis County's revenue, actually a little bit more than that, comes from sales tax, and it's about $335 million a year. And so the sort of shutdown of the economy that we've seen in response to this is going to continue to have an incredible impact on just government as we know it, and the revenue that we generate as we know it. And it's something because, again, Missouri, always being the unique sort of state that it is now, I guess, one of two states that have sales taxes that have not yet implemented Wayfair yet. And the General Assembly still has not yet figured out how to work that through. And in the meantime, governments across the state are suffering because we don't have the economic activity that is needed to help generate the revenue that governments depend on to help provide services to people. So that is certainly something that we're all trying to figure out how to work through. And once we get to the action part, that will be a part of it. So yeah, that's something that I've noticed as well.
Great, thanks. I think we had Sharonda join. Sharonda, are you there?
Yes, I am. How are you doing today?
Great, how are you?
I am here.
That is a victory every single day. Thank you so much for joining us. We had just gotten started and kicked off the and talking about some observations that both Tashara and Cora have seen throughout this crisis, and looking at some of the ways that our systems have responded and changed and shifted. I think maybe caught the end of that conversation. What have you seen, Sharonda, that in some of these shifts is both positive and negative that have been impacting Black moms and babies?
Excuse me, the weather's got my allergies going crazy, so clearing my throat a lot.
That time of year.
But what I have noticed is, for the moms that I speak to, the change in schooling, the homeschooling aspect, it's extremely difficult for a lot of parents, timing wise. If you are able to work at home, you're working from home, and your child has to do school during the same time that you're working from home. So that can create a little difficulty right there. And then not just that, I love the fact that it is positive to me that so many schools have been able to get their virtual classrooms up and running. But it also points out to me the fact that the children aren't really taught how to use computers well. So you go from just using pencils and pens at school to now everything has to be done on the computer, and the child is completely lost. So it does point out that we do need to incorporate electronics more into school on a regular basis. So if something like this happens again, the transition won't be so hard on the child and the parents. But I do like the way the school districts in Missouri have stepped up, made sure that they were still handing out food for the children, because I know for some children that is their only way of making sure that they have those 3 meals a day. So I do commend the Missouri School District for that. That's a very good thing. Health-wise, it has been a struggle. Virtual doctor visits, I actually will have my first one tomorrow, so that'll be interesting for me. But the struggles on the healthcare system and making sure that everyone can still get the care that they need, not just only if they have COVID-19 symptoms, but still being able to get the care that they need if they have just asthma or severe allergies, or that. I noticed that's a struggle right now as well.
Awesome, thank you. You all pointed out some of these shifts and changes, and then also where systems are falling short in this crisis. And a lot of the work that all of you have done has really helped to highlight this for years, and is something that has been present in the community, that's been highlighted by this crisis. And I know each of you have been speaking out about this, thinking about, what does over look like from this crisis? How do we make sure that we aren't going back to exactly the way things were before COVID-19? How do we ensure that it's not just the same as it was before, and we can address some of these gaps that you all have been talking about?
Well, first thing is elections are coming up on August 4th. And who we have leading us during this, I would impress upon your viewers to really look at who is leading and who is trying to take care of people during this crisis, because I am fearful, because I have a background in healthcare, and before I went into the legislature, I am fearful that we are reopening too soon because of pressure to get back to normal. We will never get back to normal. And I'm fearful that there will be a second wave because we are reopening too soon. And our government has done very little to encourage me that it's safe to reopen. We have not we have not tested people for COVID as we should be. We don't have PPE. I mean, it's ridiculous when you watch the news and you see governors shipping COVID tests from Korea under the guise of night and hiding them from the president. What kind of world is this where we have to hide stuff from our federal government for fear that they will take it? And they're not taking drugs, they're taking things that people need to survive this pandemic. So I would say that, to make sure that this never happens again, there are elections locally coming up on August 4th. We also have to look at our state's response. Most state representatives are up for, several are up for re-election on August 4th and also November 3rd. So I would say to everybody to lock those dates in and make sure that you show up and vote and change your leadership.
Yeah, I've got to I couldn't agree more. It's funny, something popped up in my Facebook memories not too long ago about a thing that I did a couple years ago about why it's important to vote. And my quote was, our lives depend on it. And, I think, prior to this happening, people kind of thought of that as a hyperbolic sort of a statement, but quite literally, you should vote like your life depends on it, because this shows us that it absolutely does. And the sort of people that we have in positions of authority and decision making and elected leaders can be a life or death decision. I also agree that I don't know if we're ever going to get over it. What in our lifetime, what has happened in this country and really around the world over the past 5 months now has been generation defining, and the ripple effects and the impacts of it are going to last for years and years on end, and I think is going to fundamentally change a lot of the way that we function as a society, the way that we operate and interact with each other. Now the question becomes, what sort of change is that going to look like? Is it going to be change for better, or is it going to be change for worse? I personally don't want to go back to how things were before, because how things were before got us to where we are right now. And so, I think that we really do have an opportunity that has arisen out of this crisis and all of the challenges that come with it to really have a fundamental shift and a change in a lot of the ways that we approach health, the way that we approach healthcare and the provision of healthcare, the way that we approach the economy, like all of that. And so, so I don't know what over looks like, but I know that I don't want to go back to what it was before, because it got us here.
Yeah, Sharonda?
Yes, I agree with both of you. Getting out and voting at this time is extremely important. We need changes. A couple things that I can say COVID-19 has pointed out is the holes in our economic structure and the holes in our assistance programs. The pay rate, we see how many people in Missouri now are living below poverty, but it's not just because they're not working right now, but it's also because if the pay rate had been better when they were working, they would have been able to save or have a savings for something like this. And then not just that, the holes in the assistance program. Right now, the levels are so, you have so many people falling in that hole of the highest income, but they help, especially in a time like this. You're trying to feed everyone in your house 3 times a day, but you're not getting extra income and you are above the help, the extra food stamps needed. So it's the holes in the system is extremely, it's pointed out a lot right now. So it hopefully when we vote we can get those changes.
Yeah, excellent points, all of you. We're kind of stripping away the packaging put on systems and in the way that we function, and really getting to uplifting and highlighting kind of the ugly truths that we see in these holes that you all are identifying in the system, and how many people are intentionally disadvantaged. And Cora, you bring about a point that's really important. Even though this isn't something we would we never asked for it. This isn't something we would never have wished for, but it does present us an opportunity. And I want to talk with you all and hear your thoughts on that a little bit, and kind of open up an opportunity for us to dream kind of big here. What are the conditions of an equitable system? You know, what does it look like to shift towards the better and make this new normal an equitable normal? So what comes to mind when you think about those conditions?
How much time do we have? So I mean, I can just I can tick off all kinds of policy things that I think needs to happen. I mean, paid family leave, period, no questions asked. Medicaid coverage for postpartum women for 2 years, not even related to substance use, just off the bat, which is something that we try to do. I want to fund more and more community health workers. I'm trying to make sure that the funding that got in last year in the Missouri state budget was there. Like, it's something I'm thinking about. Like, good Lord, thank goodness that we've got community health workers and people that are out in the community that have the trust of the community. I mean, got transportation, minimum wage. I mean, I can. There's so many things that can be done, but to Sharonda's point, I mean, it's what we see is this so-called safety net that, was atrophied. The holes in the safety net were, there were kind of here and there that we kind of knew of, and, it kind of hear about people kind of falling through the cracks and that sort of thing. What we're seeing now, I mean, that safety net has just completely been blown up in all of this. And so, I think that people there needs to be a real sort of a look at that in and of itself. This actually, it doesn't surprise me, but the state legislature yesterday, that I think in the Senate, had a hearing about Medicaid work requirements. Now, when you've got, you've got a whole bunch of people who are already underinsured just generally. You've got a whole bunch of other people who have lost their jobs, and then by losing their jobs have lost their employer-sponsored health coverage and health insurance. And now, for whatever reason, you think it's a good idea to somehow tie a social safety net program to whether or not people have a job or are working. I mean, it defies any sort of logic or common sense as far as I'm concerned. But the bigger point really is that, I think a lot of what an equitable system would look like isn't dependent upon the social safety or the safety net, right? An equitable system in my mind is, not having, quite honestly, I mean, I think it's incredible. I am so grateful for the Operation Food Searches and the urban leagues and, all the people that are doing the food distributions and all of that. And quite frankly, I would prefer that they not have to do it, because we've got an equitable system that is such that people can, hunker down for 2 weeks and not have their entire lives and livelihoods destroyed. That's what, in my mind, an equitable system is not so dependent upon that safety net, which has been completely decimated in all of this. So, sorry.
Yeah, and to just piggyback on that, you know, to go just a level higher. If we had universal basic income, we wouldn't and Medicare for all, then we wouldn't need a social safety net, because people right now, when we say social safety net, I think it's a misnomer, because they're falling through the holes in the safety net. So, you know, so when you look at what Canada's response was to the pandemic, they gave everyone $2,000 a month for the next, 4 to 6 months in order to survive this, because they knew that this wasn't going to be over with in 4 to 6 weeks, which is what we got from our government. And we've seen the proposals that have come from our House members in Congress that are outlining policies that match Canada's, you know, where we would have people's student debt forgiven, and public colleges would be free. There's so many things that that people are now talking about that they weren't before this pandemic started. They're looking at those things that were considered socialist policies in order to get us out of this pandemic. So yeah, I guess those would be the things that I would add in order to make sure that, because we're magic wanding right now. We're saying like what we would wish our society would look like in a society that puts equity first.
Yeah, Sharonda, do you have anything to add?
For me, say Magic Wand, those two gave perfect worlds to me. But I would also add, one of the things I've noticed having college age children, we've talked about the difference between equity and equality. My oldest, she was writing a paper and she was like, what do you mean equity versus equality? So to me, I think getting that out there more also with the younger generation will help for the future as well, because they need to know there is a difference between equity and equality, and they need to understand what that difference is and what it looks like. So I think that adding that to that mix will help a lot, getting the college age and the middle school age and high school age children, and getting them to understand that difference and understand how that will make it better. Understanding how equity will make it better. So that's one of the things I would like to add in my miracle world.
Right. I think our leaders now don't understand what equity versus equality means. The way we have to argue back and forth to show the difference. People think that granting equity means that somebody else gets less while somebody gets more. It's not pie, just making sure that everybody has what they need in order to fulfill their dreams and live life without fear of, live life without fear of, any of the things that happen because our inequities exist. And I think the other thing I forgot to add was your zip code doesn't determine your opportunity in an equitable society, right? I live in 63112, which is, depending on which block you're on, could be one of the most impoverished communities in the city. But I chose to move back to my old neighborhood. But making sure that the children that live around the corner and down the street have the same opportunities as my son, I think is also equitable.
Yeah, awesome points. I love hearing all of your passion and thinking about how to adjust and change and shift the way this was set up, which was intentional, right? The way that our safety net works, that's not by accident, that's by design. So thinking about how do we shift that, and something that I know all of you work with and are working towards, and Generate Health focuses on as well, as centering community voice in making those shifts. And those who are most impacted are the valued experts at the table in creating this change in these shifts in systems to be more equitable. So the way our system's designed now is that community comes to the system and it exists, and you kind of have to adapt to that system, rather than systems being designed to adapt to community and to people and to change with impacts and needs. I want to have a conversation about how do we change our systems in the way that we function and make decisions, so that impacted communities are the priority and those voices are the most important at the table. And Sharonda, I want to start with you, with all of your expertise and background and experience in kind of being boots on the ground. What are some of your thoughts about what we can do to make some of those shifts towards centering community voice?
Ooh, we. Oh yes, that is a complicated issue. For one, the trust is not there. Unfortunately, the community doesn't trust the government. So the hardest things to do is to get the community to open up and speak and tell what's needed, or what they think would be best to resolve an issue, because they feel as if their voices will go unheard regardless of how many times they say it, or how many, or what, in what manner that it's said. So somehow we have to change that picture, and that's the hard part, because of the system, the way the system is made. It's not made to function around community and what is needed in the community, well, the most impacted communities, I should say. Getting the resources to the impacted communities and keeping those resources there, I think, would be the only way to build the trust and to upbuild those communities, so that they will feel as if they have the power and will voice more. That's the part that I think would work the best, is to build trust, to make changes that are sustainable and will last. Quick changes like what we've set up, these temporary changes right now, they're okay for a minute, but then, as you said, when this is over, then what? How will that look? Will we go back to still having schools that don't have everything that they need in impacted communities, having the education being subpar in impacted communities? Will that change? Will parents still have to struggle just to have all of their utilities and their food and medical care? Those are the things that we need to change in those impacted communities, and that's the part that is going to be the hardest, because that does require system changes.
And yeah, I'll just add to that. So God, Sharonda, just thank you so much for what you just said, because that's, I mean, God, it's hitting the nail right on the head. Trust is critical, and quite frankly, there have been a lot of things that have been done, and decisions that have been made, from the federal level, and the Ayanna Pressley's term, the occupant in the White House, and which really has just, I think, just overall exacerbated people's lack of trust in government and their ability to kind of do some basic things like help people's life, liberty, and pursuit of happiness and or property. But, you know, the other thing is that I'll say, and it's really something because before all this happened and started, so, and within my office and as the director of policy, I've got a division that's the Office of Community Engagement and Empowerment. And one of the things that we had talked about doing even kind of before all of this started was what others have called, and I've seen even discussions about it. I think Deaconess did it. They called people-centered policymaking, where it's, you know, people are the best, or some of the best sort of, you know, evidence, if you will, about the policies that are being made, and you know, whether or not they're effective or not, or whether or not they should be tweaked, or even what sort of policies should exist or be created in the first place. You know, traditionally and historically, it's been, in policymaking has been a very top-down approach, where it's, you know, people in a room, typically, you know, old white dudes, let's be very honest, you know, sitting around a table in a room deciding, like you said, Abby, how a social safety net should look, when, you know, they probably couldn't tell you how much a carton of milk costs, right? You've got people who are making policies and laws and aren't actually connected to the folks who are most impacted by them. And so, you know, we had been really thinking about trying to transform the way that we think about policy making in general, so that it really is something that comes from the community and is driven by the community, and helps inform the policy solutions that we want to try to implement. That said, something else about all of this is just it's been kind of interesting and ironic, and I guess it's, you know, it's kind of a gift and a curse of all of this is there are a lot of people that are at home right now who have taken time to email their elected people, to call them, to submit public comments, to meetings that are being had, and those are being held online. And so again, just trying to kind of think about and shift the thinking and reframing just how things have functioned before and operated before versus what a new normal can look like. The fact that there's people that are kind of just seeing bare what the sausage making process kind of is, and are really engaging people and demanding really responses and solutions from elected leaders and people in power, I think is something that's been really a positive thing that's come out of this. You know, it's certainly, I'm sure it's been difficult and uncomfortable for a lot of people who aren't used to engaging with communities and really centering and building community in their development of policies and solutions. But I think it's good for a lot of people to finally understand, yeah, you should probably talk to the people that you're making policies for. You should probably hear from the folks that you're, you know, trying to quote unquote help, or whatever it is that you think that you're trying to do in making these decisions. Because at the end of the day, that's who is going to be impacted by this. So yeah, that's something that's kind of been on my mind, and I've talked to Tashara about it a little bit. Just it's a lot of people that are demanding a whole lot from government, which they should be, and government has no choice but to listen at this point.
I don't have anything to add. Cora said it all.
Awesome. Yeah, thank you so much for that, all of you. That it's such an important piece in our shift is, you know, even if we go to something, if we don't go back to normal, if it's not centered on those who are most impacted by policies and those who have been intentionally, traditionally kept out of decision making and put down by systems, then the new normal is no better than what it was before. So your thoughts on centering community, your work towards doing so is extremely valuable, and something that I think hopefully everybody on this who's listening to this webinar is able and willing to help support. We have a couple of audience questions I wanted to put up to you all. So this kind of goes back to what you were talking about, both Tashara and Cora talking about voting and the importance of voting like your life depends on it. So we had somebody ask, how do you all kind of plan on taking down, this is a big question, taking down the white supremacy culture that's built for centuries? So talking about how voting will change the system when it's not set in stone that whoever's elected will truly be making decisions for the people that they represent.
Well,
Oh, wow.
How do you eat an elephant one bite at a time? And you have to look at changing this system one office at a time or multiple offices at a time. For example, prosecutors. We are electing different types of prosecutors in our local municipalities now, who are looking at dismantling or trying to dismantle the arrest and incarcerate system that we have, and truly bringing tenets of criminal justice reform to prosecutors' offices. And that is slowly changing because a lot of people said, this is enough. And we're starting to see progressive prosecutors elected all across the country. But we have to recognize that part of that movement started right here in St. Louis with the elections of Kimberly Gardner and Wesley Bell. People have to realize that local elections matter more than elections 900 miles away. And so who your mayor is, who your school board is made up of, who your city council people are, your other local elected leaders have more of an impact on your day-to-day lives than the person at 1600 Pennsylvania Avenue. Now, granted, it is important who sits in the federal branch, but still the local elections, the things that are closest to you, have more of an impact on your day-to-day lives because they control a whole host of things that control your day-to-day lives. So for example, like when Pine Lawn was considering that ordinance that about young men walking around with their pants sagging, we know who that was targeted towards, and more Black and brown kids would have gotten arrested had that ordinance been passed. And the ordinances differ from municipality to municipality. We have 88, is it 88 core municipalities in St. Louis County? And then we have St. Louis City, which could conceivably be the 89th, right? And really pay attention to who's leading in those communities, whether that municipality is 5 people or 5,000 or 50,000. Those are the people that have a direct impact on your day-to-day life.
Yeah, and one thing I will add is, God, it's a really great question, and it makes me think of the Alice Walker quote about the most common way that people give up their power is by thinking that they don't have any. And when you think about the fact, you think of, if voting wasn't so important, they wouldn't be trying to take away the right or impede on people's ability to vote in the first place, right? And so, yes, I absolutely do understand and appreciate and think you're absolutely right about just, decades and really, centuries really of a system that was built upon white supremacy. And that system does not have to continue. It can be disrupted. It can be dismantled. And one of the biggest ways that it continues to be perpetuated is by giving people the sense that they don't have any power to make the changes and to demand something different. And so, another thing that I hope comes out of all of this, I hadn't done it yet, but I absolutely do intend to submit my request for my application for my absentee ballot, right? Like, and that's not anything that I'm going to necessarily wait on the Secretary of State to say, yeah, you can or cannot, be considered high risk or anything. I mean, the law is the law. You can get an absentee ballot and don't have to get a notary due to some sort of an illness or concern about an illness. That's it. That's what the people in power wrote, and it is what it is. And you have to continue to realize and lean into the power that each individual person does have to start to eat away at that elephant one bite at a time.
Yeah, Sharonda, thinking about this from a community perspective, where do you see some of those barriers and that mistrust? Where can we kind of connect community to that understanding of their power?
I again think that it starts with, I know it's harder. I know, like my generation, we do have the mentality that making that change is, if the change is slim to none. We do have to make a shift in our thinking in order to help that next generation. I always think about how what I think and what I say and what I do impacts my older children, because I have a 22 and a 21-year-old. So I've heard things that they say, and I've said, okay, the negative attitude or the negative thought, I can see it being passed on. So for one, stopping that passing on of that negative outlook on making a change, and imparting instead the outlook of, yes, we do have power, and these are the steps that we need to take in order to use and utilize that power. Getting that out to the community and getting that mindset to change from generation to generation. It's a hard fight, but it's one that has to occur. I'm constantly changing the way that I say things in order to give them a different outlook, and to realize that, yes, you have more power than you really think. And this is how you need to tap into it. So educating myself and educating that generation that's right underneath me, I think, is the best way to tackle it.
That's awesome. Thank you so much, Sharonda. And that kind of leads into a follow-up question from that same person about educating community members about their voting rights in that process. Whose responsibility is that?
Who's
Okay.
is it to what?
Sorry. So educating community and about their voting rights and the process for voting. Who's responsible for doing that education piece?
I think it's incumbent upon all of us to learn how to participate in the process and to actively recruit others to do the same. Because if we don't speak for us, who will? And it's like Shirley Chisholm said, if we aren't at the table, we're on the menu. So it's incumbent upon all of us to learn what our rights are, and to educate our friends, family, neighbors, and to get involved. Because if we don't, that's our power, and it'll be, and they're trying to take it away. So it's all of our responsibility.
Agree 100%. I don't have anything to add, because that's exactly right. Yep.
I agree as well. We do it. Everyone has to accept responsibility when it comes to the education portion of it. We can't put it all on the school system. We can't put it all on the government. We can't put it all on the parent. I think everyone has to do their part. And I do think it does start with you. Whomever has the question, it can start with you. It can start with you. You can be that starting point. You can say, okay, well, I know it. How many people can I tell? Even if you don't think they're going to listen, tell them anyway. Put it out on Facebook. You never know whose eye you'll catch. So I just think it has to be done by everyone.
And one thing that I will add, I mean, to Sharonda's point about just you never know whose eye you'll catch. I mean, you know, there have been elections, I mean, that have been won or lost by 288 votes.
888? Is that what?
That make differences in leadership. And so, you know, again, people, I mean, every single vote absolutely does count, and people need to realize that and remember it. And if you get one person as you're going out, you know, and talking to people, that one person can be the difference between Bush in the White House or Gore, or, you know, certain people in City Hall versus others.
Yeah, I think that really well kind of leads us into talking about action and what we can do is right now, especially as we're social distancing. That's kind of a tough one for a lot of folks. And Corey, you talked about this a little bit at the beginning. People are getting more engaged, and we also know that people have kids at home, and there's a whole lot more stress out in the world just because going about our daily lives is kind of scary. So I want to talk a little bit about what can we do to influence positive change and really create the equitable systems that we want to be a part of our lives. What can we do?
I know for me, what I've been doing is, since everyone is at home, I've been taking this time to have more conversations with my children, the older and the younger, just to see what do they think, what do they know. Is there something that I can show them that will help answer some questions, or is there something that I can show them that they can show their friends? So I've been taking this as a personal journey to get to know more about my children and what I can do to help them grow. What's the words I'm looking for? To help them grow and understand the power that they do have, and how being positive about things instead of looking at everything in a negative aspect, trying to change that narrative within my children, within my home, starting there first, changing that narrative so I can eliminate some of that negative, the negative ideas and the negative of what's going on in society, and how they can use themselves to be a positive influence and a positive change.
Yeah, and to add to that, I would say, you know, with this sort of change where we're all inside and conducting meetings via Zoom, even, you know, city council meetings and county council meetings have now been conducted in the same manner. It also opens the door for a lot more feedback. You know, there were times when, you know, you couldn't physically make it to City Hall or to the county council building to offer your input on legislation or things that they're considering, or just offer testimony. Now some people have the time to weigh in virtually. And I think that, you know, as far as my office, we've been broadcasting our public meetings on Facebook for several years now, because, you know, this is the people's business. So You can go to my Facebook page and you can see our entire budget sitting out there for anybody to go and review, as we reviewed a few weeks ago, because it's not our money. But it is my responsibility to make sure that that money gets into the right hands and is spent in the most responsible way. So as the city is starting its budget process, weigh in, look at what they're spending on, look at the fact that 56% of the budget is going towards public safety and only 0.3% is going to health and human services. And then weigh in, because we are your elected officials and we have the responsibility to answer your questions. And if we don't, then you can vote us out.
Yeah. I mean, I think I would just add, I mean, it's a little different. I absolutely agree with everything that's been said so far, but just in terms of just seeing positive change, I mean, and I think that it has to happen. It would be good to just, for people to be kinder to each other and just treat people how you want to be treated. And that's just kind of something internally. It doesn't have anything to do with government or anything like that, but just in terms of like the positivity and really kind of positive action. I think that's something that's really important. And, to the extent that that's not coming from certain leaders, like that are supposed to be elected people that are supposed to kind of be the moral leaders, during times of crisis. I mean, you've got, 45 just, completely perpetuating vitriol and hate and just negativity that's really just permeating society. I mean, it's a small step, but I think it's one that's really important, is really just be kind to yourself and just kind to other people. Times like this can really cause people to approach and to focus on negativity. I mean, and that's understandable, right? These are very, very difficult times right now, but the extent to which you can help out a neighbor or look out for someone else, be kind to a family member. I mean, check on your people, all that sort of stuff, can really be important, positive actions and changes that and approaches that people can have and can make and really should right now, I think.
Yeah, thank you all so much for those. And I have one question directed kind of right at you, Cora, especially because of your work on extending postpartum coverage. You mentioned this earlier. Somebody is asking, it's really important to have postpartum coverage for women on Medicaid to be extended at least a year, not just for substance use disorder, which is what we're working on now. Hopefully that waiver goes through. And so this person is wondering, what are some of the creative ways to pass that at the state level? And if you have any thoughts on that.
Wayfair recreational marijuana so that we can have more revenue to be able to pay for it. That's the big thing. Yes, we're creative ways, right? I don't even know if that's really creative, but when we're talking about it's a saying that happens, that people say all the time, but budgets are really policy documents and budgets are about priorities. I mean, like Tashara just said, if there's certain budgets that are investing in and decisions that are being made to spend money on public safety versus health, that shows you kind of what the policy priorities are for certain individuals. That notwithstanding, kind of when you're dealing with finite amounts of money and finite resources, things like moms that have substance use disorders tend to get pushed, to the wayside. I remember a couple years ago having to fight like hell for the $1.3 million in revenue that, in GR that was needed in order to pay for that program. And that's something that I think, stands at risk of being cut. It's one of the just really challenging sort of counterintuitive sort of ways in which we we support and pay for our social safety net programs and our social programs is that, you know, you do it based on revenue that you generate, but then when the economies take a downturn and more people need services, you don't have enough revenue coming in to help support it. And so that's something that's really challenging and makes things difficult. And so, I mean, there are two things that I can think of right now that can be done to really get an influx of money into the state, and then ultimately into programs that and policies that really need to be funded, and that's Wayfair and recreational marijuana. And then, you know, they could also roll back some of the corporate tax cuts from Senate Bill 509, but you know, we'll see what the likelihood of that happening. But again, I don't know if that's creative, but it's doable, and it should be done. And if we're at that action part yet of the program, that's something that I would say, you know, call on the folks up in Jeff City, and not the ones, not just the ones that you know are with you, but the ones that need to hear it, and demand these sorts of solutions.
Right, like how asinine is it to add a work requirement to Medicaid when so many people are filing for unemployment?
I mean,
you know, and then they don't realize, the people who add these things to our laws don't realize that the people that they're hurting the most are the people that are in their own districts. So we won't go there.
yep.
Hey, Cora, will you give a brief description of the Wayfair fix you're talking about?
Oh yeah, so basically right now in Missouri, we don't, we do, but it depends on who you talk to. Purchases that are made online, paying sales tax for them. The Supreme Court a couple of years ago, I think it was 2017 or 18, I can't remember, decided that states could charge online sales tax and collect online sales tax. And so there has to be a change in our state law in order to allow that to happen. And in St. Louis County, we would have to also get it put on the ballot and then have it voted on by the public and the people. But if you just think about it right now, you think about the fact that there's so much commerce and so much of the economy that has actually kind of moved online right now as a result of COVID. All of these transactions and purchases that are occurring are not generating any sales tax revenue right now without this Wayfair fix. So we've seen estimates before this started, before COVID happened, that could help St. Louis County bring in an additional $20 to $40 million per year in revenue just from this fix. And I don't really know what it would look like or looks like now, kind of what these changes, but that's what it is. And there's a big debate from some of the conservative, the gang of, what they're called, the Gang of Six, the Conservative Six, the 6 conservative members of the Senate, as well as some House people, or some members of the House, rather, House people, that are very, very opposed to what they consider a tax increase when it's there. It's just Missouri has to start collecting the online sales tax. So that's what Wayfair is.
Thank you for clarifying. So you're talking, I mean, this is a policy change thinking about revenue, and you both of you talked about funding. I want to hear a little bit from all of you about some other policy changes that we could be advocating for, big, small, off the wall, kind of whatever, things that we could be advocating for that could really help shift some of these systems towards equity.
One of the things I was working on with a coalition of people around the state was Missouri was considering offering universal child savings for any baby born in the state of Missouri. I believe the initial deposit was $100. and that would be paid for by their fees right now that we receive for the for our 529 program from the company that administers that program. And I testified in favor of it. You know, St. Louis has the second largest children's savings program in the nation. And if you, and children who have less than $500 saved are 3 times more likely to go to college and 4 times more likely to complete college than children without savings. And encouraging children to look at their post-secondary options as, you know, early as 5, and telling them that they have a savings account also changes their social emotional behavior, and reduces that disparity between children from affluent backgrounds and children from non-affluent backgrounds, who just by the existence of a savings account with a few dollars in it. And also, you know, it would reduce the amount that parents have to take or children have to take out for loans as they start looking at post-secondary options, because every dollar saved avoids $2 to $4 in student loans. So that could totally change the trajectory of and increase the number of children who are pursuing post-secondary options, because we know that in today's society that almost 2/3 of the jobs that are available require some sort of post-secondary education.
Yeah, I just want to add, you know, one of the things that I think needs to happen, and it's about priorities and budget again, is really more investment in prevention and primary care. You know, it's something else that's been highlighted a little bit, but I don't think it's been discussed as much as, I mean, it probably will be as this starts to happen more and more, but like you're hearing about like the BJCs and the SSMs that are having to furlough workers right now. And if you think about the fact that we're in the middle of a public health crisis and a pandemic, that seems a little bit counterintuitive. But the fact of the matter is, right now, the way that the healthcare system is set up in this country is that the reimbursement, the funding, the money goes to specialty care and goes to very, very specialized sorts of healthcare services, and a lot less investment goes into primary care and public health and prevention. Now, don't get me wrong, specialty care is great. Like it's wonderful that BJC has one of the most advanced NICUs in really the state and the world, and that's really important. And quite frankly, the work that we could do and could be done ahead of time to make it so that women can have healthy births without having to use the NICU would be something that I would want to see. And so investing in things like nutrition and well checks and the sorts of things that are primary care services that can actually just help people live healthier and weller, I don't know if weller, more well lives is something that I think that I really would like to see. I mean, we see it right now. We see that hospitals can't survive if they're not doing, these special elective surgeries, or that their revenue, they're really hit and hurt hard if they can't perform these elective surgeries. And we also are seeing that they're not necessarily equipped for public health crises like this as well, and outbreaks like this as well. And so what I would like to see is more significant investment in public health and primary care as preventative tools and measures to keep people healthy and well and not having to go to the hospitals and the emergency rooms in the first place.
Awesome. Thanks, Shonda.
Now, Corey, you are making too much sense.
I've been known to do that.
Just too much sense.
What I would like to see is not only, excuse me, not only an increase in the minimum wage, because as we can see from this pandemic, that's very well needed. An increase in the minimum wage is well needed, but not just an increase. So increase everyone's pay. We also need to follow that up with an education on how to maintain a proper budget, what really should be included in your budget. And not only your budget, but yes, you're going to have a budget and you're going to have a food, how to shop healthy with that food amount that you've allocated in your budget. What can you do to have healthy meals that'll help, like Cora was saying, preventive care? If you're eating properly, that'll also help with preventive care. So education on a proper budget, once we do get that extra income, that's not really extra income, but that needed income increase, how to budget, how to budget it properly for your family, how to make sure that your family is getting everything that is needed, food wise, utilities, clothing, all of the things that are needed, but how to budget that properly so that you can not only have all of those things plus money in your account. So I think that education part would help with that. So increasing the minimum wage and educating families on proper budget and food.
Yeah, Sharonda, now you're talking my language. Because nothing changes your life more than love or God or a 100-point increase in your credit score.
Exactly. Exactly.
Awesome. Well, we're right at time, even though I feel like we could continue this conversation forever. But I wanted to thank all of you so much for your expertise and your time and your work in bringing all of that to us and continuing to fearlessly lead us through this crisis and as we continue on. So thank you so much, all three of you, Sharonda, Cora, Tashara. Your this conversation lit my fire for sure. And I'm sure that everybody who participated is extremely inspired as well. I know that you all are continuing work on, so we will be sure to encourage folks to follow you on social media and keep track of what your offices and what your community groups are doing to see all this wonderful work that you're doing. Please fill out the survey we're going to be sending out later. We would love to have everyone's feedback. I also want to thank my Generate Health team who's been working behind the scenes this whole time to make sure that this webinar goes off well and gets your questions answered and make sure that we have everything that we need. So thank you to the team, and thank you to everybody who came and participated today and for all that you do for moms and babies in our region. We definitely can't do this work alone. So every single one of you who is taking the time and your talent to ensure that we are moving to a more equitable society, it's extremely valuable work. So thank you so much. Following this call, you will get a link to this webinar as well as that survey I just mentioned. We really love to have feedback. So if you all could fill it out, that would be awesome. And we'll also compile any information and resources shared that we can send to all of you. So please feel free to share this recording and those resources widely. Thank you so much to everyone, and stay safe and healthy. Thanks.